viewer, and welcome to the Mental Health Program, where we bring you information to promote awareness on mental health issues and for mental wellness. This program is brought to you by Hope Channel Kenya and myself, Florida Afifu. I am a clinical psychologist and a relationships coach, and I'm very privileged to engage you on this program. Today, we are moving on to the 7th episode of this 13-part series of mental health program. All our previous episodes are on our YouTube channel, and you can engage with us if you have questions or any concerns on the chat section of the YouTube videos for this program. Last episode, we talked about depression. And in summary, we learned about depression as a mood disorder that affects our mood, affects our thought and behavior, with symptoms ranging from depressive moods, sleep problems, eating problems, diminished interest on activities that previously were enjoyed by an individual, psychomotor agitation or retardation, diminished ability to concentrate, and also recurrent thoughts of death, suicide thoughts, suicide attempts in cases of depression in certain individuals. We also learned that depression has a significant impact on one's health, physically, spiritually, occupationally, socially, and emotionally. Depression must be treated, and the good news is that depression is treatable. We emphasize that in the cases of suicidal thoughts or suicidal attempt, then urgent help should be sought at the hospital's emergency section, or you can call up a suicide hotline, or also you can look up for your therapist or seek the help of a professional mental health expert. Today, we want to talk about yet another disorder that is commonly diagnosed in our society, and this is anxiety disorder. Anxiety is a feeling of worry, nervousness, or unease about something with an uncertain outcome. Experiencing occasional anxiety is a normal part of life. Anxiety is our body's normal, natural stress response. It's a feeling of fear and apprehension about what's to come. Ordinary anxiety is a feeling that should come and go, and it should not interfere in any way with our everyday life. But when your feelings of anxiety are extreme, when they last longer than 6 months, in cases of some anxiety disorders, and when they interfere with your day-to-day living, with your functionality at the family level, in your workplace, or even at school, then you may be suffering an anxiety disorder. Anxiety disorders are characterized by feelings of intense, excessive, and persistent worry and fear about everyday situations. Often, anxiety disorders involve repeated episodes of sudden feelings of intense anxiety and fear of terror that may reach a peak within minutes. These are otherwise referred to as panic attacks or anxiety attacks. These feelings of anxiety and panic interfere with our daily activities and are difficult to control. They are often out of proportion in comparison to the danger that we are faced with. People suffering anxiety disorders always try to avoid situations or prevent places that may cause them the feelings of anxiety. Symptoms of anxiety disorders include the feeling of nervousness, restlessness, or being tense, having a sense of impending danger, panic, or impending doom, having increased heart rates, rapid breathing, sweating in some cases, trembling, feeling weak or feeling tired, trouble concentrating or thinking about anything other than the present worry, having trouble falling asleep, experiencing gastrointestinal problems, having difficulties controlling worry, and having the urge to avoid things or situations that may trigger the feelings of anxiety. There are different types of anxiety disorders. One is agoraphobia. This is a type of anxiety disorder in which you fear and often avoid places or situations that cause you panic and make you feel trapped, helpless, or embarrassed. For example, someone would be suffering a fear of enclosed places. And so if you are in a place that is closed, for example in the lifts, you may feel intense fear, intense worry, and be in a state of panic. Other people or other forms of agoraphobia would be the fear of crowded places. And you may feel intense fear or worry or be very anxious when you are in a crowded place. And to deal or to cope or probably to numb the feelings of this anxiousness, an individual may decide to avoid such places or avoid situations that causes them this fear. We also have anxiety disorders due to medical conditions. And these are symptoms of intense anxiety or panic that are directly caused by a physical health problem. Another form or another type of anxiety disorder is the generalized anxiety disorder. Generalized anxiety disorder includes persistent and excessive anxiety and worry about activities or events, even ordinary routine issues. Usually, generalized anxiety disorder is marked by worry which is out of proportion to the actual circumstances. It is difficult to control and it affects how we physically feel. Generalized anxiety disorder often occurs alongside other mental illnesses such as depression or even alongside other anxiety disorders. Another type of anxiety disorder is panic disorder. Panic disorder involves repeated episodes of sudden feelings of intense anxiety and fear that always peak within minutes. You may have feelings of impending doom, shortness of breath, chest pains, or rapid fluttering or pounding heart. These panic attacks may lead to worry about them happening, being a cause of further anxiety. And an individual may respond by trying to avoid situations that may cause the panic attacks to recur. It is important to note that panic attacks sometimes are situational. At other times when they happen, they don't happen because of a particular trigger or because somebody has been exposed to a situation that triggers them. We also have selective mutism as a type of anxiety disorder. In selective mutism, a child may fail to speak in certain situations, such as school, while they can very well speak and communicate in other situations, such as at home and with close family members. And this can interfere with the child's functioning, their performance in school, and even with their relationships in the community. Another common type of anxiety disorder is social anxiety disorder, or otherwise referred to as sociophobia. In social anxiety disorder, an individual experiences high levels of anxiety, fear, and avoidance of social situations due to feelings of embarrassment, sometimes concerns maybe self-consciousness, and concerns about being judged or viewed negatively by others. There are other specific phobias that form part of anxiety disorders, and this is where one experiences major anxiety when exposed to a specific object or situation and a desire to avoid it. Phobias provoke panic attacks in some people. We know of people who have phobias for snakes. Others have phobias for insects. Phobia for water, where when one gets into the water, even if it's just up to their knee, they experience serious anxiety, feeling as if they're already drowning in the water. And so these specific phobias that cause us intense anxieties are also part of anxiety disorders. There is also separation anxiety disorder, which is common in childhood, characterized by a child experience intense and excessive anxiety feelings not consistent with their developmental level, and is usually related to separation from our parents or to a primary attachment figure or someone who plays parental roles to the child. We have several anxiety disorders that are not specified, and they can be diagnosed by your doctor in the event that you're experiencing the symptoms that we had earlier on listed. Your worries may not go away on their own, and they may get worse over time if you do not seek help. It is therefore important that if you're experiencing symptoms similar to what we have listed, you don't have to feel all the symptoms. If you're feeling a significant number of those symptoms, you need to seek help, because anxiety may not just go away on its own. And if it is left for long, to linger for long, then it will worsen and treatment becomes a little bit challenging and complicated. You need to see a doctor when you feel like you're worrying too much and it's interfering with your work. It's interfering with your relationships and other parts of your life. You need to see a doctor when your fear, your worry, and your anxiety is too upsetting and difficult for you to control. When you feel depressed and have trouble with alcohol or other substances or behaviors of addiction, and you have mental concerns alongside with your anxiety. When you think your anxiety could be linked to a physical problem, when you have suicidal thoughts or suicidal behavior, you need to see a doctor so that you can discuss your anxiety and you may get help when it's still early. See your doctor or your mental health provider before your anxiety gets worse. It is easier to treat anxiety if you get help early. Now let's move ahead and consider what could be the causes of anxiety. Causes of anxiety are many, and the list that we get is not exhaustive. There is anxiety that comes and the cause cannot be explained. But there are causes such as life experiences that have been established to be causing anxiety. When one experiences traumatic events in their lives, they are more predisposed or prone to experiencing or developing anxiety disorder. Sometimes traumatic events trigger anxiety disorder in people who are already prone to anxiety. Inherited traits could be a factor in terms of genetics and learned behavior. A child may learn anxious response to situations in life as a result of them observing their parents or their attachment figures respond to life stressors in a way that shows anxiety. Anxiety can also result as side effects of certain medication. There are medications that are prescribed to us, whether as a treatment to physical illnesses or mental illnesses, that could also cause anxiety as a side effect. Therefore, it is very, very important to discuss the side effects of the medication that you are prescribed, and if any of it is to cause anxiety, you are supposed to work with your mental health service provider to come up with the coping mechanisms that reduces the symptoms of anxiety or restructures your mind when you experience anxiety as a result of a medication of prescription. There are medical causes of anxiety. This is where anxiety comes as a result or is linked with an underlying health issue. In some cases, anxiety signs and symptoms are the first indicators of a medical illnesses. In other cases, anxiety signs and symptoms come as a result or as part of the experience of the disease that one is suffering from. When anxiety symptoms, or when your doctor suspects that your anxiety symptoms could be an indication of an underlying medical problem, then your doctor can suggest tests to establish the kind of medical problem that one may be suffering from. Medical problems that are linked to anxiety include heart diseases, diabetes, thyroid problems such as hyperthyroidism, respiratory problems, disorders such as chronic obstructive pulmonary disease or asthma, drug misuse or withdrawal, and also withdrawal from alcohol, withdrawal from substances of abuse, and withdrawal from certain anti-anxiety medications. Chronic pain and irritable bowel syndromes are also physical problems that are linked to anxiety. There are also rare tumors that produce certain fight or flight hormones in the brain that could also be a symptom of, could also cause anxiety or are also linked with anxiety. It is possible that your anxiety may be due to an underlying medical condition if you do not have any blood relatives that have experienced anxiety before, if you didn't have anxiety disorder as a child, if you don't avoid certain things or situations because of anxiety, or if you have a sudden occurrence of anxiety that seems unrelated to life events and you didn't have a previous history of anxiety. Your anxiety may also be as a result of a medical problem if you don't have problems with alcohol or any other substances of abuse. There are risk factors that may increase your chances of developing an anxiety disorder. Trauma is one of them. Children who endure abuse or have experienced trauma in their early ages of development or witness traumatic events are at a higher risk of developing an anxiety disorder at some point in their life. Adults who experience traumatic events can also develop anxiety disorder. Another risk factor is stress due to an illness. Having a health condition or serious illness can cause significant worry about issues such as treatment and your future generally. And this can cause anxiety disorder. Stress buildup. A big event or a buildup of smaller stressful issues may trigger excessive anxiety. For example, death of a loved one, stress at work, or ongoing worry about finances may cause anxiety. And when this prolongs over time, an individual may develop anxiety disorder. Certain personalities are more predisposed to anxiety. People with certain personality traits are more prone to anxiety disorders than others. Personality traits that makes it difficult for one to cope with difficult situations predispose people to anxiety disorders. Other mental disorders such as depression or other anxiety disorders may also present with anxiety as part of their symptoms. Having blood relatives with anxiety disorders is also a risk factor because anxiety may run in the family because of genetics or maybe learned behavior. An individual who is using drugs or alcohol can also get anxiety disorders, either as part of as a result of the intoxication or as part of withdrawal from that particular substance of use or abuse when an individual is not using. Now, having an anxiety disorders causes more than just worry, more than just intense fear and the feeling of doom. Having an anxiety disorder can also lead to or worsen other mental or physical health conditions, such as depression. Depression often occurs with anxiety disorder or other mental health disorders. Substance misuse can be precipitated by anxiety or can lead to anxiety disorder. Insomnia, digestive or bowel problems, headaches and chronic pain, social isolation, problems functioning at school or at work, poor quality of life, or suicide are all complications that come about as a result of anxiety disorders. Once you have been diagnosed with anxiety, you can explore treatment options with your doctor. In moderate or severe cases, treatment can help you overcome the symptoms and lead a more manageable day-to-day life. Treatment for anxiety falls in two categories: psychotherapy and medication. Meeting with a therapist or a psychologist can help you learn tools and skills to use as strategies to cope with your anxiety when it occurs. Medication for anxiety are typically used to balance the brain chemistry, to prevent episodes of anxiety, and to ward off the most severe symptoms of anxiety. For some people, medical treatment isn't even necessary because lifestyle changes may be enough to cope with the symptoms. Lifestyle changes can be an effective way to relieve some of the stress and the anxiety you may cope with each and every day. Most of the natural remedies consist of caring for your body, participating in healthy activities, and eliminating the unhealthy ones. And this include getting enough sleep, meditation, staying active and exercising, eating a healthy diet, staying active and working out, avoiding alcohol. Many people use alcohol as a sedative to calm them so that they may not feel anxious or they may not feel the extreme symptoms of their anxiety. Other times, people who are anxious in social situations may use alcohol to help them bring down their guard in a social situation. And as a result, there is dependency and addiction that results from this kind of a coping. So avoid alcohol and avoid use of drugs and substances of abuse or even behaviors that are addictive, such as pornography, gambling, or any other behavior that one may use to cope with their anxiety. Avoid caffeine and avoid use of cigarettes. In conclusion, there is no particular way to predict for certain what will cause someone to develop an anxiety disorder. But you can take steps to reduce the symptoms or the impacts of the symptoms if you are anxious. It is important to understand that anxiety disorders can be treated even in very severe cases. Although anxiety may not go away as soon as you'd want it to go, with the help of a psychotherapist and through lifestyle changes and other natural remedies, you can lead and manage a good and happy, healthy life even with anxiety. Most importantly, seeking treatment earlier increases your chances of full recovery. It is easier to treat anxiety when you seek treatment earlier. Anxiety is not God's will for us. Anxiety opens doors for iniquity in our lives. As a way of coping or numbing the anxiety, many find themselves in addictions, such as sexual addictions, pornography, alcohol, and other substances of abuse. Anxiety threatens the peace and the abundance of life that Jesus died to give us. It causes us disease physically and mentally. It interferes with the social and emotional well-being and impacting negatively on these very important aspects of our existence. Anxiety is contrary to the peace and that God gives us to guard our minds and to guard our hearts. And so God provides us with one prescription for anxiety that we must not lose sight of. In Philippians chapter 4 verse 16, the Bible tells us that we should not be anxious about a thing, but in everything with prayer and supplication, with thanksgiving, we should let our requests be known to God. So the prescription for anxiety that we are given as Christians is prayer. Prayer is not something that fails. Prayer has been tested, prayer has been proven to do wonders and to change our experiences. When we let our supplications known to God, and when we remain thankful for the good things that God has given us and the experience that God has given us, and we focus ourselves on where we are winning with God, then our anxiety levels would be reduced considerably. Remember that anxiety can be treated, and when you seek help early, your doctor and your mental health service provider will be able to guide you on how best your anxiety can be handled. Anxiety impacts negatively on our health, and we cannot afford to remain silent in the face of anxiety. Let us keep telling about this to our friends. Let us exercise this information in our lives that we can live more productive and healthier, happy life. That's it from us today. We hope to see you again on this program next week at the same time.